This is an amazing opportunity to understand how groups all over the world are incorporating patients into their curriculum and practice. And so this is a conference where you can be really inspired to do that in your own program for your students and for the people who they will ultimately care for. You know, I've been to lots of conferences. I think this is the first time, just by looking around, where patients and community members outnumber the academics and clinicians, and I love it. It's a wonderful vibe, and it's bringing a totally different angle to things that we think about in our university classrooms and offices.
I've been a nurse for 28 years, and it is the best conference and most applicable to what we're doing, and I feel very, very privileged to be here. I have already been writing down a lot of gold nuggets on how to make a very meaningful volunteer patient program, how to grow, how to really integrate ourselves into medical learning, taking away all the experiences that people have shared with me during the conference.
I mean, the main difficulty is that we have to choose which conference we won't be able to attend to, because most of them are so interesting that we have to make some hard decisions. It's a great conference. I'm really happy to be here.
I think being a student, it can be sometimes intimidating to come to these conferences, not thinking that you bring a lot of knowledge or a lot of things to the table, but everybody has been super, super nice and supportive, especially at all the sessions, including the workshops, and it's just been really great to feel like your voice is heard and just to collaborate with everybody and hear from everyone. It's super great as a student to be able to learn.
The best part was to understand the perspective of patients in medicine and correlate that with my studies and my background, trying to always go back and think about what a patient is actually going through. That is very helpful for me as a person who is studying in medicine, trying to be a better healthcare professional in the future, hopefully.
This conference is really important for me as it connects me with all the leads, all the researchers who've been working on patient-partner engagement over the course of years. It's been patient partners, researchers, educators, community partners, so many people from all over the world, and we all have a common goal. There is so much imagination and innovation in this area, and some of it's not published yet, right? So being in the room with the folks who are on the ground doing the work is just so exciting, and I'll be able to support where I work a little bit better because I've been here.
It's dealing with a subject that's really important and that really kind of helps support foundational and systemic change kind of thing. Shifting the priorities of how we approach health professional education to really kind of focus on the needs and values of the end users.
It's special to be able to share. I have such a long history with medical professionals, being, diagnosed so long ago. So the experience I think that I bring really makes a difference.
We are still quite a few scholars and educators and patients around the world interested in this, so by attending this conference it would be a nice opportunity to come home and tell about what's happening in the world in this topic. We do need this conference more often than every 10th year, at least every 5th year, so that's my appeal to the committee that is organizing. We need it more often. We need to meet and gain momentum within this field.